Is colon cancer hereditary? What causes it? Yes, colon cancer, colorectal cancer, has a genetic component in some cases, but not all. About 5 to 10% of colon cancers are related to genetic factors, usually due to specific genetic syndromes. The majority of the remaining cases, 90 to 95%, are due to non-genetic factors. Genetic factors. 1. Genetic syndromes. Lynch syndrome, hereditary non-polyposis colorectal cancer, HNPCC, is the most common genetic syndrome associated with colon cancer, accounting for about 2 to 4% of cases. Caused by mutations in DNA repair genes, MLH1, MSH2, MSH6, PMS2. People with Lynch syndrome have a 70 to 80% lifetime risk of colon cancer, which usually occurs at a young age, before age 50. In addition to colon cancer, this syndrome also increases the risk of uterine, ovarian, stomach, and urinary tract cancers. Familial adenomatous polyposis, FAP, due to mutations in the APC gene, accounts for about 1% of colon cancers and causes hundreds to thousands of polyps in the colon, which almost certainly progress to cancer if left untreated. MASH usually appears in adolescence or young adulthood, requiring prophylactic colectomy. Other syndromes: Peutz-Jeghers syndrome, Maudich-associated polyposis, MAP, also increases the risk of colon cancer, but is less common. 2. Family history. If you have a first-degree relative, father, mother, brother, sister, with colon cancer, your risk is 2 to 3 times higher than someone with no family history. The risk is higher if a relative has the disease before age 60 or has many relatives with the disease. Signs to note about genetic factors. Many people in the family have colon cancer or related cancers: uterine, ovarian, stomach. Cancer appears at a young age, under 50 years old. There are many polyps in the colon or rectum. If you suspect a genetic factor, you should have a genetic test to detect mutations, e.g., MLH1, MSH2, APC. Get early screening with regular colonoscopy, especially if you have a family history. Causes of colon cancer. Colon cancer develops due to a combination of genetic and environmental factors. Here are the main causes. 1. Genetic factors. Genetic mutations, Lynch syndrome, FAP. Family history of colon cancer or related diseases. 2. Non-genetic factors. Diet. Eating a lot of red meat, beef, pork, processed meat, sausages, and low in green vegetables and fiber increases the risk. A diet high in saturated fat and low in fruits and whole grains also contributes. Lifestyle. Smoking increases the risk of polyps and colon cancer. Excessive alcohol consumption, especially if consumed more than 2 drinks a day. Obesity. BMI over 30 increases the risk of colon cancer in both men and women. Sedentary. A sedentary lifestyle, sitting a lot, not exercising, increases the risk. Underlying medical conditions. Ulcerative colitis or Crohn's disease. Chronic inflammation in the intestines increases the risk of cancer. Colon polyps, especially adenomas, which have a risk of developing into cancer if not removed. Type 2 diabetes, associated with insulin resistance, which increases the risk of colon cancer. Age. The risk of colon cancer increases significantly after age 50, especially in people without genetic factors. Environmental factors. Long-term exposure to toxic chemicals or radiation may contribute. 3. Other factors. Gut bacteria. Disturbances in the gut microbiome, due to antibiotics or diet, may promote inflammation and increase the risk of cancer. Vitamin D deficiency. Some studies suggest that low vitamin D levels may be associated with colon cancer. How to prevent colon cancer? Whether you have a genetic predisposition or not, you can reduce your risk by taking the following measures. 1. Regular screening. Colonoscopy every 5 to 10 years, depending on your age and risk, starting at age 45 or earlier if you have a family history. Blood test for cancer markers, CEA, or stool test for occult blood, FOBT. 2. Healthy diet. Increase fiber, green vegetables, fruits, whole grains. Limit red meat, processed meat, and foods high in fat. Supplement foods rich in calcium, vitamin D, milk, fish, eggs. 3. Healthy lifestyle. Exercise at least 30 minutes day, 5 days week. Walking, jogging, yoga. Maintain a healthy weight, BMI 18.5 to 24.9. Quit smoking, limit alcohol. 4. Manage underlying medical conditions. Good treatment for inflammatory bowel disease, Crohn's, ulcerative colitis. Control blood sugar if you have diabetes. 5. Genetic testing if at risk. If you have a family history, consult your doctor about genetic testing and early screening. Thanks for watching the video. Wish you and your family health and happiness.